friend, and today we're going to talk about another category of psychological condition known as neurocognitive disorders. Neurocognitive disorders are characterized by acquired deficits in cognitive functioning. These disorders do not include those in which impaired cognition was present at birth or early in life. Type of cognitive disorders include type of neurocognitive disorders. They include the many subheads, but such as delirium, schizophrenia, etc. But we'll just talk on a few. The first one is delirium. Delirium, also known as acute confusional state, that develops over a short period of time, usually a few hours or a few days, and is characterized by disturbances in attention and awareness. Major and mild neurocognitive disorders have the primary feature of acquired cognitive decline in one or more areas, including memory, attention, language, learning, and perception. These psychological cognitive disorders can be due to medical conditions including Alzheimer's disease, HIV infection, Parkinson's disease, substance and medication use, vascular disease, and others. Let's talk about schizophrenia, which is one type of neurocognitive disorder. Schizophrenia is a chronic psychiatric condition. Calling it a psychological condition, it's one way, but it's really a chronic psychiatric condition that affects a person's thinking, feeling, and behavior. It is a complex, long-term condition that affects about 1% of people in the United States. The United States DSM-5 diagnostic criteria specify that 2 or more symptoms of schizophrenia must be present for a period of at least 1 month. One symptom must be one of the following. A. Delusion or delusions. Delusion is beliefs that conflict with reality. Another type of symptom is hallucination. Hallucinations is seeing or hearing things that aren't really there. Disorganized speech is another symptom. Words do not follow the rules of grammar or language and may be impossible to understand. Apart from this first type of symptom, there's another secondary type of symptoms, which may be one of the following. Grossly disorganized or catatonic behavior. In other words, confused thinking, bizarre behavior or movements. Negative symptoms, which include the inability to initiate, plan, speak, express emotion, or feel pleasure. Another one is diagnosis also requires significant impairment in social or occupational function for a period of at least 6 months. The onset of schizophrenia is usually in the late teens or early 20s, with men usually showing symptoms earlier than women. Earlier signs of the condition that may occur before diagnosis include poor motivation, difficult relationships, and poor school performance. The United States National Institute of Mental Health suggests that multiple factors may play a role in causing schizophrenia, including genetics, brain chemistry, environmental factors, and substance use. While they say that there is no cure for schizophrenia, there are treatments available that make it possible to manage any symptom or condition. Treatments usually incorporate antipsychotic medication, physiotherapy, self-management, education, and social support. Now, we're now going to leave schizophrenia alone and move to another under the subhead, which is called obsessive compulsive related disorder. Obsessive compulsive related disorder, or OCD. Obsessive compulsive and related disorder is a category of psychiatric condition that include 1. Obsessive compulsive disorder, which is OCD for short, body dysmorphic disorder, hoarding disorder, trichotillomania, hair pulling disorder. I read that again. Trichotillomania. That's what they call hair pulling disorder. Excoriation disorder, which is skin picking. Excoriation disorder, which is commonly known as skin picking. Substance/medication-induced obsessive compulsive and related disorder. Obsessive compulsive and related disorder due to another medical condition. Each condition in this classification that we've just mentioned, we've mentioned about 6 or 7 of them, each condition in this classification has its own set of diagnostic criteria. So let's take the first one, obsessive compulsive disorder. The diagnostic criteria in the United States DSM-5 specify that in order to be diagnosed with obsessive compulsive disorder, a person must experience obsession, compulsion, or both. Let's talk about obsessions. Obsessions are defined as recurrent, persistent thoughts, impulses, and urges that lead to distress